Sheila left the studio, she whispered in my ear, if you ever need me, come and see me.
It was one of the best things I've ever witnessed in my life. It's brilliant. Oh.
Okay.
Well, if you're not in tomorrow morning...
Right then.
Sorry.
So, it's been reported that up to 9% of dogs in the UK are carriers of MRSA and could potentially pass the hospital superbug on to humans. So how worried should we be?
Well, here to answer that question is veterinary surgeon Mark Abraham. Is this something we should worry about?
Not really. I mean, it's something to be aware of. MRSA, it's a superbug. It received so much PR. Everyone got terrified of it. I think as long as you stick to sort of simple hygiene procedures, wash down surfaces, litter trays, obviously, humans can be a reservoir for pets. Pets can be a reservoir of the bug for humans.
Yes.
But just be careful, really. It's a bit of a scaremonger.
Usual rules apply. Washing hands, all those sorts of things.
Washing hands, especially if pregnancy, for example, or someone's on chemotherapy or open wounds, young,
even
old.
more vigilant.
Just simple hygiene that should minimise risk.
Okay,
yeah.
Brilliant.
Nearly 60,000 animals reported stolen in Britain last year. Now, we had a look at these figures, because that is an awful lot. Quite a lot of those are bees, so that lifts the numbers up considerably. But then we're talking about sort of sheep and fish out of people's ponds, but dogs make up 1,135 of the thefts.
Yeah, it's a big deal, especially in this current economic climate. It's a way of making money. So dogs can be used for fighting, so staffies are the most stolen breed. They're also used for bait dogs and dog fighting, so dogs that are actually used as bait.
Oh, that's horrible.
Horrific. And also there's dogs that are used for breeding. And of course you've got the pugs and the chihuahuas, which are very commonly sold on, because people can make money.
Dogs.
Expensive handbag dogs.
How do you prevent your dog from being stolen? Obviously you say don't leave it unattended.
Well, 52% are stolen from the owner's back gardens. So keep your dog supervised. Don't leave it in cars. I still see dogs tied up outside shops. It's easy for people to just come along, you know, they just have to cut the lead and they're off. Make sure your dog's microchipped. If your dog does get stolen, contact dogloss.co.uk and sort of use Twitter, use Facebook, make that dog hot property so it can't actually easily be passed on. There's tracking collars now as well. So it's very common, but the most important point is to prevent your dog being stolen in the first place.
Okay, right, let's rattle through our pet clinic now and see how many we can get to. We've got Kim and a Yorkie puppy.
Here's Kim.
Hello, Kim, what's the problem?
We've got a hoppity puppy.
Oh, look.
Okay, this is a rare condition we've got here, so we're very lucky to see it, and I'm going to use this tiny camera to focus if I can.
How old is the puppy?
12 days.
12 days, and the problem is that she's got missing the lower part of her leg.
So she's got a missing limb there. Now, whether she was born like it or whether the mother chewed it off, sometimes with the first litter they can be over-enthusiastic and chewed the foot off. Most important thing is they cope very well.
Right.
They can live their whole life. As long as it doesn't get infected, if it gets sore or inflamed, go and see your vet, obviously. It may be a job, once this little puppy's fully grown, to visit our mutual friend Noel, the super vet, to fit a prosthetic limb.
Yeah.
So this is definitely a candidate for that. So
nothing to worry about, just
they
sort of
cope
keep
very
an eye
well.
on it.
I mean, even, you know, cats, dogs, even after road accidents, they cope very well with 3 legs. They make great pets. It doesn't affect them whatsoever. They're fantastic.
They're gorgeous.
Nothing to worry. They're absolutely gorgeous. Thank you very
well
much.
done.
Indeed.
Thank you very much.
Thank you for coming in.
Next up, thank you. We've got Lisa and her King Charles Spaniel, Bertie.
Bertie's got a sore eye. Let's have a look at you, Bertie.
Hello, Bertie.
Hello. So what's making Bertie's eye so sore?
Okay, so this is Bertie, Cavalier King Charles Spaniel, beautiful dog. We're going to try and focus on the eye. It happens at certain times of the year, which is the biggest clue, isn't it, Lisa? And what we can see there is a very sort of red, pinkish, swollen, what's called the conjunctiva, so it's conjunctivitis. It happens usually about in the summer months.
Do you think it might be an allergy, Lisa?
Yeah, definitely. Sort of when the tree pollen starts, it definitely starts then, but it's sort of on and off. I've stopped choosing things in the house, like, you know, sort of in the carpet and fresheners in case it's anything like that. But
of course.
It does come and go. It goes on to about October.
Oh, bless, but very painful, I imagine, uncomfortable. So what can be done?
So it's itchy. It's a very likely an allergy. It's both eyes. What can be done? First of all, we have to make sure that it is an allergy to pollen and not food or fleas or anything else. See your vet, obviously. But really, it may require, instead of just treating the symptoms, which is eye drops, for example, it may be actually referring to a dermatologist, a skin specialist, finding out what the allergy is and using that allergy to then perform some immunotherapy. So make vaccines, almost vaccinate your dog against pollen for the best future health for your pet. So dermatologist, well worth investing in now. Pet insurance, vital for this sort of thing. Get it sorted out, and your pet can live a very happy life being allergic just with the right treatment.
Okay.
Thank you.
Thank you very much
indeed. George, you're next,
Thank
and
you.
there's Staffy Rottweiler Cross Bean, who's 2 years old. He's got separation anxiety.
Oh, Bean.
Hello, Bean.
So how does this separation anxiety manifest itself?
Well, if I leave the house in the morning, say I don't come home in the evening, I stay out, she won't eat until I'm home.
Oh.
She's also learnt how to open the doors in the house, but it'll only be my door that she'll open. So we've got locks now on the doors at home so that she can't get in.
But you want to make life a bit more comfortable so that she's happier when
Well,
you're not there.
yeah, completely. But she's not on her own all day at all. There's always somebody around.
But if you're
for
not
her.
there,
But if
she
I'm
won't
not
eat.
there, she won't eat.
So it's just you.
What do you do with that? How do you retrain a dog?
Okay, so separation anxiety, very complex problem. It's an umbrella term for many different conditions. Basically, first of all, she's a beautiful dog. Staffy crosses, they get a lot of bad press. Look how gentle she's being. Rescue centres are full of them. Go and adopt one. But basically, this is a dog that was hand-reared from 10 days of age, so she didn't have her mum to give her that template to deal with life. So first of all, she's got that over-dependency. It can be dealt with. It can take time. You need to be patient with your dog. But basically, practice saying goodbye and hello. Don't make an issue of greeting and coming back or saying farewell. Use an old T-shirt that smells of you to leave with her. Use toys to keep her occupied. There's many things. It can be done with time. Basically,
What about socialising with other animals?
It's not a cure, but it can help. But this dog is dependent on Georgia, so we need to
What
deal
about
with
you
that.
tape yourself and just press play and have your voice talking while you're not there?
That helps. So the first 15 minutes of Georgia not being there is the most critical. That's when they can really panic.
Yeah.
And this is mild separation anxiety. Sometimes they can mess in the house. They can tear the place to pieces. So the first 15 minutes, play the voice, TV, radio, distraction. Try and get through that. But basically, it's unsocialised puppies that are very prone to this.
So if you've got a puppy, socialise it. Otherwise,
Socialise it.
what could happen?
Yeah, she was dumped
obviously,
at 10 days old and then hand-reared.
Obviously, if you're getting a dog, if you're getting a puppy, make sure you see it
Something to
interacting
think
with the
about.
mum, not from a pet shop.
Thank you very much. Good luck with her. Next, we've got Miranda and her Yorkshire Terrier, Cassie. Cassie's got conjunctivitis. Oh, look.
Little Cassie.
Hello, Cassie.
Hey.
So you...
So a similar sort of problem to the dog we talked about before.
It's a conjunctivitis. It's an inflammation of the conjunctiva, which is part of the eye. This is a very different condition. It's not allergic. It's round the clock, 24/7.
No tear duct at all.
Every day.
Really?
So this is keratoconjunctivitis sicca, dry eye.
Okay.
So basically, you can't produce tears. Now, whether that's because the tear ducts were destroyed at birth, or it's a breed thing, or it's just happened because we don't know why, but we need to deal with it, and you're dealing with it in a very industrious way.
Very difficult.
Taking lots of time, is
Drops all the time,
Really?
every 2 to 3 hours, 3 lots of medical drops
Wow,
each day,
gosh.
and about 6 or 7 washes, eye washes.
And that's really probably, I would have thought, there's not much more you can do, is there?
There's one more thing you can do, which is a very last resort. So we've got this intensive therapy going on. You can't take a holiday. You can barely. I mean,
Well,
the
she
only
comes with us.
respite you get is obviously when you go to bed, because lubrication is provided naturally by the eyelids. But there's a last resort, which is actually to transplant the ducts of the salivary glands up to the eyes. So that's every time the dog eats, or every time the dog smells food, the eyes get lubricated, and this can't happen. The problem with that is obviously you get an overproduction of fluid. The ducts
runs
can't
down their
handle it.
face.
Runs down their face, and also you get mineralisation of the skin. So that's a last resort. It's expensive. It's very, very tricky surgery, but it is a last resort. But for the moment, it's drops, it's ointments, and what you're doing is
And lots of
fantastic.
time.
Because these dogs are also prone to ulceration, which is painful and actually can result in losing the eye.
She
So
had 3 ulcers.
she's had 3 ulcers.
Bless
So
her.
there's a lot going on.
Thank goodness she's got you.
Well, I know. She's got a good mummy
I've
there.
got 2 other dogs as well.
Well, you are busy then.
Yes.
Thank you very much. I loved your grandmother as well. I know
Thank
she's
you.
just had a...
Yeah,
she's in
if I
hospital,
can we
isn't
just
she?
say
Yeah,
to
yeah.
everyone at Canter Reward at the Chase Farm Hospital in Enfield. Brilliant hospital. Thanks for looking after her. She's well on the mend.
Good. Lovely to hear it. Thank you very much. For more advice and information on anything Mark's just talked through, see our website.
Martin Lewis is here with his guide to haggling after the break.